Hey YouTube, it's Marida and welcome to another edition of Nurse Lounge. In this edition, this video is done by request and they wanted to know my story of how I dealt with or what happened when I had a racist or dealt with a racist student. I think she meant in nursing school or maybe not. I don't know. But anyway, we'll tackle both of those. So in this video, we're going to talk about three things. How do I handle racist students? How do I handle racist patients? And how do I handle racist coworkers, things like that. And then also we will kind of dive into me discovering people that were racist that I didn't even know they were. They hid it pretty well until certain things happen. So anyway, if you want to see what that story is about and how I handle these situations, please stay tuned. Welcome back. My name is Dr. Marida P. I am a registered nurse. I have been a nurse for 17 years. OBGYN is my specialty. I am a nurse educator. I teach at HBCU. I'm doctorally prepared. And in this video, we're going to jump right into the topic right here. We're going to talk about how I have handled or how I have dealt with racist situations with the things we just talked about in terms of racist patients, racist students, racist coworkers or staff, doctors and such. And then, like I just said, and how all that is handled. So let's go ahead and jump into racist students. So me being a nurse educator, I have to say, as a nurse educator who, keep in mind, and this video is not to attack any kind of race or anything like that. I'm presenting my experiences, okay? So when I present my experiences, I'm doing so this is not for somebody to come back and tell me that my experiences are not valid because you didn't experience that. These are my experiences. I was asked the question. I'm going to answer the question. And I'm very truthful and honest and straightforward about my experiences. So these are my experiences, okay? When it comes to dealing with, in this particular situation, racist students. So I have had plenty of situations. As a matter of fact, I had a situation story time. Actually, this whole video will be kind of like a story time in and out. But when it comes to racist students, I find that the more education that I have, the less receptive that these students are of me being their instructor. A lot of times they don't feel like that they can be receptive to instruction from someone who happens to be Black. I have been told that I am intimidating. I have been told that I am strong personality. I have been told that I talk too fast, which I do talk fast. I would have to say the strong personality, that is very accurate of me. Talking fast, that is accurate of me. But in terms of being intimidating, now what people have to understand about being intimidating means if you are intimidated, that's an issue with you, not with me. So that's what people don't understand. If I'm intimidated by someone, it's because I have a weakness somewhere. So if you can't handle me being strong, or people say, okay, well, you need to change this, that, and the other. No, ma'am. No, sir, I'm not changing anything. Why? Because if I have to change my strong personality, why don't you have to change your weak one? Explain that. So why can't we accept people for who they are? And because I happen to be well educated, because I happen to be someone who basically knows her stuff, someone who backs up her stuff with evidence-based practice and research, and someone who just doesn't fly at the, if you ask me something, I'm going to tell you I don't know. Or if I don't know, I'm going to tell you go look it up. And people are like, a lot of students are used to being coddled, and I don't coddle. That has nothing to do with race, but I just don't coddle. I don't, because nursing doesn't coddle. It is what it is in this profession. That doesn't mean I don't help you. That means I'm a facilitator in what I do. Facilitate means to guide someone. It does not mean that I hand it to you. It means I point you in the direction of where the answer is. You go seek and find the answer based off of that. If it's an emergency situation, that's something different. Now, With a racist student, it was a situation where I was having her to go in and pass a colace, a simple colace to a patient. I had taught all the students how to use the CAL, which is computer on wheels, how to scan the patient's armband. I've taught them how to do all that. She didn't feel comfortable doing that. She didn't feel comfortable going in by herself to pass a medication. So I said, okay, well, you're a senior student. You're about to graduate in like 2 months. You need to know how to do this on your own. But I will come in and stand by the door and watch over you. The thing is, when an instructor comes in, and if you're required to do so by your facility, by your school, then you do what you're supposed to do. But I do not believe in hovering over my students. Now, if I see that he or she is weak and they need someone who is hand over hand, they're going to need somebody to stand over them. That's something different. But I knew she had the capability of doing very, very well with passing a medication by herself using the scan system. I don't know. I think she just had anxiety. And because they had never done it before. And these students were like, I've never did that before. I've never passed a medication by myself. Okay, well, what you gonna do in 3 months? Pass it by yourself. So we're gonna start that process here. And we're talking about a colace, y'all. We're not talking about like Lortab. We're not talking about doing an IV, any med. We're not talking about programming pumps. We're not talking about doses cal. We're talking about passing a colace, a stool softener, by yourself. Pop it in the little cup, hand it to the patient, scan all this stuff, save it on the computer. You're done. All the other students did well with it. They were so excited they got to do something by themselves. And again, with narcotics, I don't allow my students to pass narcotics by themselves because it is a narcotic, it's a controlled substance. So I do go in the room with them, but I stand by the door and watch them from there. I don't necessarily just hover over them. But this was not a controlled substance. So anyway, she passes the medication. She does a great job with it. I tell her how great she did. And so then she walks out the room, and we walk out the room, and I go to the next student. So the next student, like, okay, let's go pass your meds. So she went back and said something around she went back and said something, and then she called me by my first name. She says, Marida. And I looked at her and I'm like, excuse me? And at this time I didn't have my doctorate. But you never call anybody by their first name. If you don't call your instructors by their first name, that is rude, that's disrespectful, that's unprofessional, it's inappropriate. So that's kind of how the whole thing started. And she's like, I did not like, this is her talking to me, I did not like how you made me go do this, that, and the other. It was unsafe. Anyway, I said, you know what? You did a great job. If you don't like it, I don't know how you're going to survive and when you become a nurse. Well, I'll get there when I get there. Well, you're going to be there in 2 months. The whole point of clinical is to get you ready as best we can for practice. So you going to pass the medication by yourself, which you didn't do because I was actually in the room with you, it is not unheard of. Anyway, she went and reported me to the coordinator of the course. Then she went and reported me to the dean. And she went and said that I made her do this by herself and everything like that. She went and lied and said that, I made her go here by herself. And so then they called a meeting. They called a meeting. I have to go into this meeting explaining my side of the story. She was there. I said, so you're telling me you went in there by yourself? You're telling me I wasn't standing? So she had to change her story at that point in time. And so then then she was excused. And so one of the other instructors was like, she said that you were intimidating. She said that you have a strong personality. All the things I just named already. And then the coordinator's like, you know what? I do find you to be the same way. I find you to be intimidating and having a strong personality. I said, you know what? The strong personality is because of the fact that you all can't handle someone with a strong personality because you all have weak personalities. I can't help it that you coddle people. I don't coddle. And I follow the rules and you all don't. So when I follow the rules and then you all undermine me with students, it makes it look like that I am someone who, for one, I'm incompetent. Number two, they're going to roll 10 on me and I need to change what I'm going to do. And that is their way of getting by on you when you do that. So I said, you know what? I am not changing who I am. I could say that you are someone who caves into the students. I could say that you're someone who doesn't know how to lead because you don't lead. You let the students lead you. And I said, that's kind of like a parent-child scenario right there. Parent-child scenario or faculty-student scenario relationship. I said, someone has to lead and somebody has to follow. And I said, you are letting the students lead you. So who is credentialed and who is not? I said, because you're showing the student that they have the RN behind their name and not you, when you're the one who is getting paid to teach them how to be, in this case, a registered nurse. So once I said all that, they all was like, oh, I'm so sorry. You're right. You're right. You're right. So again, I go back to the fact of who, why do I need to change my strong personality if you don't have to change your weak one? Why don't we accept, what, she has a strong personality. Let's figure out how we're going to approach her. The same way I figure out how I'm going to approach my weak or timid students. Okay. I don't sit there and yell at them. I don't yell at anybody, but I don't do all those types of things. I'm like, okay, what is it we can do to help facilitate this to make it easier for you? I prepare my students for everything. I'm direct and to the point, and people do not like people who are direct and to the point. They rather be sugar coated with sugar coated shit, so to speak, than for me to tell you exactly how it's going to be. And then the thing is, when they send you out there to this real world of nursing and you are not prepared for it because you had sugar coated shit your entire program, and you're like, okay, nursing school didn't prepare me for this. Well, you know what? Because you had one of those confident instructors. I'm not that kind. So when it comes to the race situation, I have found that when I'm the only minority faculty, or one of like 2 out of 60 faculty at a university or in a setting, it is very difficult to manage, because when you are the only minority there, for one, people don't know how to take you. Number 2, they don't know how your culture is, or they don't even know how your culture is. They have a bias towards you. They are judgmental, prejudice towards you, and they discriminate towards you. And when I was at this facility, I would notice that the people who would come in and be over me were somebody that I had to go back and train. I had to train the person over me. What sense does that make when I actually have the credentials and the capability of doing that? So how did I handle that situation in terms of being trained and training people? You have to know when to move on. You will not disrespect me. So what I did do is I sat down, had a meeting with everyone. I told each and every one of them, professionally, mind you, since they had no problem pointing out to me what issues they had with me, I had no issues pointing out what issues I had with them. And I told every last one of them. And I based it off of a policy that we had in place that showed, exactly what I was talking about. This was not related to race, but when I present the facts to them, and that's what we have to do as minorities. We have to present the facts to them. They can't, a lot of times they can't handle the facts. If I say the policy is this and you did not do the policy and I did, and as a result of me doing the policy, now I'm the bad guy, they had nothing to say, because they knew they were wrong in this particular situation. This is exactly what they did. So I just happen to be someone who, I'm a policy follower. I do what I'm supposed to do. And I make sure that my students are taken care of in terms of making sure that they know what they need to know to be nurses. I am not here to be their friend. And a lot of the faculty I work with are wanting to be students' friends. No. I'm not here to be your friends. I already got that. I'm here to educate you about what your responsibilities are as a nurse. Now, I kind of dived into the student situation as well as the faculty situation. The faculty, it's the same thing in terms of when I deal with other racist faculty. I worked at a place in which they refused to teach culture to these students. So they had no black faculty at all. When they interviewed me, they said, what can you bring? Why should we hire you? That's the question they asked you. Why should we hire you? And I said, I looked at your, when you have those composites of students on the walls in your halls, and you have the student composite of this class, this class, this class, this class. I looked at those composites and I noticed that they were very diverse. They all come from different shades of brown, different parts of Africa, different parts of the world, and of course Caucasian students too, but yet you have no faculty that represents your students. So when I interviewed for the position, I simply said, you know what, you have a diverse student body. You need diverse faculty that represents that student body, that represents the patients that are the populations they'll be taken care of when they go into the real world of nursing. Oh, they were floored by that. They not floored, but they loved it. They loved it. So I got the job. Okay. Now, this is the people who hired me happen to love all that. The people I worked with, they were like, oh, we don't teach culture. We don't teach culture. How do you don't teach culture when culture's on the NCLEX? Number one. How do you not teach culture when when it comes to nursing considerations, culture is a part of that? Number two. So what I would do is when I had them in clinical, and this is an LPN program that I'm speaking of, when I had them in clinical, what I would do is I would teach culture to them. So I would say, okay, let's talk about different cultures and talk about the implications and what they like, what they don't like, what they do, what they don't do. Because, and I still do this to this day, in every clinical group I have, I talk about culture. Because, again, statistically, as of 2020, Caucasians are the majority. But guess who is second behind them? It's Hispanics. They are 18% of the population, and blacks are now 12 point something, 6% of the population. It used to be blacks were the second or the highest minority group in population, but we are now the second group. You have to teach these things to students, because how do I, since we have 18% of the US population as Hispanics, how do I engage with these people? They don't, a lot of them don't speak English. What do we do? What do we teach our students about, being bilingual, or what resources do they have to help communicate with these students? They don't teach any of that. So when it came to that, I found that they had issue with me teaching culture. Issue number two, because I was working at an LPN program, I was actively pursuing my doctorate at that time. And they would talk about me so bad to the students, mind you, that was so unprofessional. They would simply say things like, I don't know why she's going to get her doctorate. I would never do that. I'm happy with my bachelor's degree. Okay, well, do you? Number one, that's unprofessional. You don't ever go to another student to talk about another instructor, especially good, bad, or indifferent. You don't. And for you to have to say that you don't know why she's doing that, because I would never do that, shows that you have some jealousy issues and you have some issues within yourself as to why you didn't do it. Because someone who is proud of where they are and what they do, they don't have to knock anybody else. And they don't have to bring up that they're proud about what they do. It just shows. They just do it. So there's people who choose not to go on to get their master's degree and doctoral degree. That's perfectly fine. But why would I want to knock you for doing something that's positive for you? That's your life. Do you. So you're maybe saying, well, what does that have to do with race? What does that have to do with race? It has everything to do with race. They do not want us to advance. The more we advance, the more power we have, period. And I'm just stating it exactly how it is. The more education you have, and this is anybody, not just black people or minorities. The more education you have, the more power you have, the more you know, the more you can't be tricked. You can't be bamboozled. You can't be hoodwinked because you are educated. That is the issue with that. Now, that's faculty. What about in the hospital setting? How do I handle the hospital setting when it comes to, I end up leaving that job, by the way, for another job. And I'm not having any issues at that particular job. Now, how do you handle at the hospital racist nurses and racist doctors? I personally have endured all these things, and I just don't even care. Your issue with me looking the way I look, I can't help what I look like. I'm a product of my mom and my dad. They put them two together, this is what you get. I don't understand how we have issues with people looking the way they look when we don't control how we look. Okay, I didn't actually be born, neither did you all. Here we are. Again, the product of our mother and our father. So whatever them two people come together, look, and whatever came in that pot, that DNA pot, is what we came out with, and here I am. So when it comes to doctors, I have had issues, and I have a story time that I think I will link to this, because it was a get ready with me story time that I will link to this, so you can see what I'm talking about, because I don't want to go through the whole story here because it's a bit much. But again, I was going to school at that point in time to get my master's. Anytime you are trying to advance, they will take issue with you. Anytime you try to advance, they will take issue with you. If they have that kind of racist bone in their body. Everybody's not the same, because all Caucasian people are not racist. Okay, they're not. But the ones who are, they will rear their ugly head and show you that they are. So when it comes to racist physicians, and I have had my credentials questioned. I have had my like when I do my assessments and things like that, when I call the physician for something, I've had that questioned. Well, what does Nurse Sally say? I'm just giving an example. What does Nurse Sally say? So put Nurse Sally on the phone. Nurse Sally says the same thing that I just said, but okay, and you begin to realize then it's an issue with you. Now, if I was a new grad and they had issues with what I'm saying, okay, because they have to get to know you and know that you know what you're talking about. But I wasn't a new grad in this situation. I was someone who had at least 10 years experience, and on and on and on. And there's one physician, me and him would always butt heads, always. It was to the point where if I saw him coming down the hallway, I would literally turn and go the other way, even if it was out of my way. Even it was just that bad. It was just so toxic. He retired, and I'm so happy he retired. But I had a situation with him where his patient was hemorrhaging. And I said, we need this, 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 and this. He said, well, who are you, the nurse or the doctor? I said, I'm the nurse who's providing you an S bar, and the R in S bar means recommendation. This is what I recommend that we do to take care of your patient. And if you don't want to do that, then you simply say you don't want to do that. So anyway, he says, no, I don't want to do that. He didn't want to start the IV on a patient that's hemorrhaging, by the way. Okay. All right. Put in the orders that he didn't want to do that. No orders received. Recommended to do X, Y, and Z. Said this, that, and the other. So then what I did was I called a rapid response, and I said, this is what I need to happen. And the physician would not allow that to happen. After that, he had to physically come into the hospital. Oh, he was livid with me. Had to physically come into the hospital. And guess what we got going? An IV. Because I knew what needed. He said, didn't I tell you we didn't need an IV? Okay, well, she's hemorrhaging. You want her to die? I said, your choices was this. I start the IV, start the Pictocin, start the things that I need to get done, the fluids, or you can find her in the morgue tomorrow. That's your only two choices. It was up to you. And you chose violence, so to speak. So I did what I had to do. He did not like that. So again, he did not like my strong personality. I overheard him say that black nurse thinks she knows it all. I evidently knew more than you. Or because of the fact that you have such a racist bone in your body that you could care less about the patient. You so worried about the fact that I knew what I'm supposed to be doing. You wanted to tell me what I needed to do when I already knew what I needed to do. And the nurses are kind of like, well, he's one of those that you're going to have to be. No. We're not playing those games yet again. I hate when they say, well, that's just how he is. That's just how she is. Well, why can't I be just how I am and that be acceptable? That is not how it works in the real world. So I had those issues. I set him straight right then and there. And I have not had, well, up until he retired, I hadn't had any other issues with him. When I called about something, this is what I expected to be done. This is what I want you to do for your patient. If you don't, I will document accordingly and call a rapid response. It's just that simple. I don't have time for the games. They learned that about me. Now, racist patients. I have had several racist patients. And believe it or not, I had one, my very first year as a nurse, who she said, she blatantly said, I do not do black people at all. I don't do black people. I said, okay then. And by this point in time, I had been a nurse for maybe about 8 to 10 months. I said, okay then. I said, well, I'm only a nurse working on the floor. So I will document that you don't want a black nurse. I will notify your physician, and I will see you in the morning when the next shift comes in, because I can't do nothing for you. And that's exactly what I said to her, and I left it at that. By say 2 o'clock in the morning, she calls out her morphine PCA had ran out. And I said, I'm still the only black nurse out here. And according to our conversation earlier, you didn't want a black nurse. So the next shift don't come in until about 7 o'clock in the morning. Would you want me to come change your PCA? If you're the only nurse out there, no, I don't. I don't like black people. Okay, have a good night. Documented all that and said what, did what I needed to do. And by 2:30, I guess the pain got pretty bad. And so she said, there's no other nurse you can go get? No, ma'am, I'm it. If you want medication, this is how it's going to be. And she let me change her PCA. I'm not going to change the mind of someone who's a racist. I'm not. But I'm going to do my job. I'm going to care for the patient regardless of what their beliefs are, how they feel. I don't care about all that. My job is not to judge you based off of you or treat you based off of your tendencies. My job is to take care of you no matter what. And I plan to do so. I don't care what your issues are. So, and then the very next day she comes in talking about what a great nurse I was. How was she know? I wouldn't dare have to, I was there, but I was in her room only twice or 3 times during the entire shift. And one time, and at that point in time, I said, well, in order to get your PCA changed, I need to do an assessment, because she refused for me to do an assessment on her too. And she was just like, you have to do an assessment. I said, yes, you've had one done every single shift. It's time for me to do an assessment. And if you want that PCA changed, that's what I need to do first. I cannot provide you with anything unless I have vital signs and an assessment on you. And we got it done. And then she went telling everybody I was the best nurse she ever had. I don't know what the issue is with some people. It is what it is. But my thing is this. We have to do the best we can. I try not to take it personal. And I actually don't take it personal. I have now learned that people who are racist because of something within them. It has nothing to do with me. And so since it has nothing to do with me, I mind the business that pays me. They don't pay me. So I don't really care. If I'm working in a facility in which I feel like I'm working for people who are racist and people who are advancing around me, and I'm not, and it's not because of the fact that I lack skill, I lack intellect or experience, it's because of what I look like, then I'm moving on. It's just that simple. I am moving on. Why would I stay somewhere where I'm not wanted or respected? Same thing with a relationship. Why would you stay in a relationship that you're not wanted or respected? You move on. And that's exactly what I've done. Now, when it comes to patients, or not patients, but nurses, I have met some nurses who, they were as sweet as pie. I live in Tennessee, so we're in the Bible Belt area. It's the South, Southern Bells, things like that. The whole nine. Everybody is just as sweet as can be until we got Barack Obama as president. When he became president and I started reading my Facebook feed when he became president, I really learned who I was dealing with at that point in time. Or when the president after him, when Trump came into office, I learned who I was dealing with at that point in time. So you have these covert racists. You're like, oh my gosh, I never knew. And they speak to you every single day, every single, hey, how are you doing? You done told them your life stories. I have a nurse friend, so I thought, well, not anymore, who me and her was thick as thieves. She's Caucasian. We're thick as thieves. We worked together. She would give me part of her shifts when I needed it, because I needed it for extra money to take care of my children. She would give me part of her shifts. She didn't care. She's like, okay, and we worked together. I helped her. She helped me. When I had my baby, she was, this kind of nurse. She would have my babies when we were there. What ended up happening was she ended up moving to another state, another job. We're still friends. We're still talking, everything like that. And she made a post of a black man who killed somebody in her family. Now, you may say, well, she was angry about that. Of course she was. And I'm not defending the black man. He should be locked up in everything he did for killing anybody. I feel that way no matter what race you are. You have no right to go around killing anybody. But her words and her post told me she was not who I thought she was this entire time. That was the issue. She called this man a coon and all kinds of slander words that you would not be using if you were talking to somebody black. If she was talking my presence, I think she must have forgot that we Facebook friends, or she got black friends on Facebook, because when she made that post, I was very much in awe or shocked about what I read. I'm like, this is a person who came to my dad's funeral. This is the person who came when I had my babies. I just couldn't believe it, And so I learned at that point in time that, you know what? Sometimes situations will bring the worst out of people and show you who people truly are. And when they show you, you believe them. At that point in time, I unfriended her and not spoke to her since. She may not even know that we're unfriended at this point in time. I don't deal with fake people. So to answer the whole question of what you asked, I just don't deal with fake people. Fake people meaning people who act one way in front of me and act something different away. I don't deal with them. When it comes to racist anybody, I will speak my mind. I will not come out and say that you're a racist, but a lot of times the issues that we're talking about may or may not have nothing to do with race. Well, it does have to do with race, but it will be an underlying issue, or it be the overlying issue, but you will have another issue as to why you can't handle or deal with me. I'm going to be who I am the same way you're going to be who you are. If we cannot respect each other for who we are, then why are we both here? So when it comes to dealing with racist patients, family members, things like that, stand your ground. You are who you are. When it comes to dealing with racist anything, stand your ground. If you want to remove yourself from the situation, remove yourself from the situation. Go to your chargers and say, you know what? I feel uncomfortable in the situation. They are making remarks. They are mistreating me. They are whatever happens to be, and see if you can get another assignment. When it comes to the physicians and doctors, I just handle them with, or physicians and doctors, that's the same thing. Physicians and nurses, I handle them with a long-handled spoon. I'm matter of fact. I remain professional, but once I learn who they are, I just deal with them accordingly. I simply say, this is what I present the situation to them. This is what I need to happen, and go from there. If it gets so toxic where I can't deal with that environment, then I move on. It's just that simple for me. I am no longer trying to prove who I am to anybody. I can't help what I look like, nor can you, or anybody for that matter. So why are we spending so much time on what somebody looks like, and why they're advancing and why they're doing this, that, and the other? Because you have insecurities within you. That person has insecurities within them, and they want to project that onto you because I don't know why you're this and the other. Because you think I'm inadequate because you're inadequate. Okay, let's call it what it is. You are inadequate, and you think that's what you think. You are finally met your match. You've met someone who knows more than you. You've met someone who knows why we do stuff and not the fact that we just do it. And that is intimidating to people. So keep in mind, intimidation doesn't mean that I said something negative to them or that I was mean to them. Sometimes intimidation means education. You have more education than them. Intimidation means that you have more substance than them. Intimidation means to them that you are or you have more options than they have. So I can't help that I am a goal getter. And I can't help that I am ambitious and driven and that you're not. That's not my problem. So with that being said, that's why I'm intimidating to people, and I don't care. That's how I handle all that. I move on when I want to move on. I handle them with a long-handled spoon. I get out of situations that I want to get out of if I can. If it's a situation that I know that they're racist, but they really don't care that I provide care to them, then I keep my assignment. I don't really care about that because I'm here to take care of you, and that's pretty much it. I'm not here to sway anybody to say, okay, now you need to become not racist. You're not going to change that about people. The only thing you can do is be you and demonstrate to them that you know how to do your job. And for some people, that will never be enough, and that is okay. Just know that. All right, so this has been kind of a story time wrapped into one. So thank you for watching this video. Follow me on IG, follow me on TikTok if you so choose. Handles are here on the screen. And until the next time, you all take care. Bye-bye.